Smoking Prevention Project in Kindergartens. The nosegay of experiences of our childhood consists of many colorful flowers. Pictures, sounds, stinks, sweet smells, tastable and tangible materials are stored on the endless shelves of the continuously expanding walls of our memory storeroom. Later, as an adult, intentionally wandering between the lines, looking for something, we rearrange and find our pleasant and unpleasant memories. We face our past and present opinion activities. Smoking, cigarette, glowing embers, ash. Why and how it began? Whether it began with those things that the smoker talks about, that he still remembers even now, probably not. However, those things which he does not remember, which he cannot recall, still determine his present habits and behavior. What can these experiences be? I wonder if you can clearly describe those personal characteristics and environmental influences which later lead to the first cigarette and regular smoking. Is it possible to model and try what is the exposition and intensity of that combination of characteristics and environmental influences that a person must be exposed to in order that he became a smoker? Or why is it that under the apparently same circumstances, having the same characteristics, the other part of people remain non-smokers? One thing is for sure. The basic behavior patterns are imprinted as early as in the day nursery and in the kindergarten, and this is unfortunately true for smoking as well. Our basic idea is that organized smoking prevention activities could and should be conducted from an age when the receptive brain of the child is exposed to the negative smoking promotion effects which influence his or her present and future behavior. As far as we know, more and more kindergartens have children who have already tried out smoking. According to statistical data, people not only try their first cigarette at a younger age, but they also start regular smoking earlier. We can face these challenges successfully only then if we start prevention activity even at kindergarten age. Based on the above, we have developed the smoking prevention program in kindergartens. The main tasks of the program are to make children know the cherry symbol, to make them accept its message, to give children information corresponding to their age, to form children's attitude about smoking in a way that they could more easily choose the healthy lifestyle, to make children more conscious and active against the compulsion of passive smoking. Method. The handbook made for kindergarten teachers is an essential help in implementing the program, since it serves as a methodological guide and description of the suggested lessons. The four main topics to deal with are perception, personality, health, smoking. Another important part of the program is the tale, The Four Lives of Squirrel Chista, which was written from special points of view on our request by István Csukás. The illustration drawings were made by Zsuzsa Füzesi. In 2001, in the monitoring phase of the program, we sent 187 questionnaires to the kindergartens, and after processing the data of the 89 questionnaires sent back to us, we can say the following. The program was supported by the major part of parents, mainly the non-smokers. Another favorable feedback is that half of the parents have changed their smoking patterns. For example, they do not light the cigarette in the presence of their child. They do not smoke when they are in the kindergarten. Some of the parents, though, felt uncomfortable because their child told them not to smoke. According to kindergarten teachers, children's level of knowledge about smoking has increased. 48% of them have become more refusing to smoking. 70% of kindergarten teachers used some teaching aids of the program package even in activities besides the program. 90% of the teachers qualified the content of the program package useful. The cherry symbol, which can be considered as the emblem of the program, was liked by both children and parents. The results show that it is worth dealing with this topic even at the age between 5 and 7. Children have received the information and understood the cause and effect factors. Since passive smoking has come up in the program, children asked adults not to light a cigarette in the same airspace. Among the programs to reduce the smoking attributable morbidity and mortality rates, the smoking prevention program in kindergarten plays an important role. This program can only be effective for the society if the whole generation of kindergarten-aged children would get to know it. Nowadays, out of the 4,000 kindergartens in Hungary, more than 550 have chosen our program. Expert opinion on the program was given by the expert of the Teachers Training Institute of Budapest, Mrs. Pázsik Gabriella Szilágyi, and the expert of the Behavior Science Institute of the Semmelweis Medical University, Dr. Béla Buda, and they both recommended the dissemination of the program in the kindergartens. The program, as a sub-program, can be found in the database of the Program and Curriculum Development Center of the National Institute of Public Education, increasing the possibility of being able to be chosen by more and more kindergartens. When inserted into the yearly education curriculum, and when its implications are mentioned in other, for example, environment protection topics, the program efficiently shapes the view that children have about smoking. The Minister of Education has given license to the 30-hour teacher training course to implement the program in kindergartens.